you haven't signed up for insurance yet through Access Health CT, there is still time. Today, the head of the company is once again urging people to see if they qualify for assistance.
NBC Connecticut political reporter Mike Savino joining us in studio with more of the details. Mike?
Yeah, Mike and Keisha, it seems like this situation is constantly changing, with Connecticut now stepping in to cover some of those subsidies that expired at the end of the year at the federal level. That's why Access Health has extended the enrollment deadline until January 31st, and the agency is now also suggesting that people talk with a broker to see if maybe they're qualified for more help.
Now, my message to the public at this point is if you have not enrolled, you have until the 31st.
State officials are reminding people to take advantage of health care subsidies. Congress let enhanced subsidies under the Affordable Care Act expire, but Connecticut is filling in the gaps for many people.
Having health insurance is a big deal because it will spread the risk. The pool will be stronger, and when you have a stronger pool, you'll have better rates in the future.
Low-income residents who received subsidies even before COVID are not impacted by any of these changes. But Connecticut is using roughly $70 million from an emergency fund to fully replace enhanced tax credits for people who earn twice the federal poverty level. That's individuals making $31,000 a year and families of four earning $64,000. Meanwhile, households making up to 5 times the poverty level, $78,000 for individuals, $160,000 for a family of four, they can still get partial subsidies. Lawmakers back in November put $500 million into this emergency account, and Governor Ned Lamont in December tapped into that fund to pay for these subsidies.
That's why, working with our friends in the legislature, we set up this standalone fund. Working with our friends in the legislature, we said we got your back.
Access Health Connecticut says they've seen a 3% jump in enrollment, but many people signed up back in November, opting at the time for a lower cost plan in case subsidies expired. Now, Access Health is asking people to contact an insurance broker to see if they can actually get a better plan.
We're going to reach out to those folks. Say, you know, you can come in, and then maybe we could buy up.
Now, Connecticut is one of 5 states that is directly funding insurance subsidies while we wait for Congress. The U.S. House is set to vote this week, while the Senate works on its own compromise. And coming up at 6, we'll take a look at what could that mean for people here in Connecticut if lawmakers down in Washington do ultimately reach a deal. But for now, live from the studio, Mike Savino, NBC Connecticut News.